Page 660. Patients known as universal reactors are allergic to practically everything in the environment. Pathology of methylmercury poisoning symptoms. Mercury exerts a destructive effect on nerve tissue. 1972, Hughes and Spiker. Stress can cause irritation, anger, and resentment. Insomnia, depression, and illness. Feel in charge of your own life or be a victim. Control over your life begins with your thoughts. Self-discipline, mastery, self-control starts with taking control of your thinking. Eleanor Roosevelt said, "No one can make you feel inferior without your consent." Table of contents from the patient with amalgam removal, ADA positives. Mercury toxic. Patients have multiple symptoms. Mercury vapor measurements and other screening procedures determine the need for removal. DAM's newsletter, Progress in MS After Amalgam Removal. Testimony of a 55-year-old woman with MS. List of all the symptoms suffered from January 1985 to December 1994 when she quit taking her meds. 4 years of listening to doctors and getting worse. Neurologist said nothing he could do for me. 3 months after amalgams removed, chelation therapy to remove the mercury, 5 treatments didn't feel any different. Quit. 6 or 8 months after amalgam removal, her knees quit buckling. You are a part of God's tree, a branch, not a root. Picture of a woman getting teeth examined. Page 661, stress and unhappiness. Assert yourself, do something else. Strauss, stop struggling, get a sense of control. Index from the dental law book with mercury and fetal malformations. Mercury attaches to part of the protein that travels throughout the body. 23 dentists interviewed, 11 aware mercury could be harmful, 2 took precautions. 25 assistants, 7 aware mercury could be harmful. Name, people, Dwayne Jazinka, a son with symptoms of 55-year-old with MS. Paralysis in the legs, treatment was prescriptions, steroids, chemotherapy, antibiotics for infections. 9 years followed. Medical advice got worse. December 16th, 1990. 2023, available on YouTube's 60 Minutes aired of mercury in amalgams. Hal Huggins' book. Dentists and neurologists called it a hoax. April 1994. Chiropractor. Juicing and using colon cleanser symptoms improved. Nutritionist said to totally detox, amalgams needed to be removed. DAMS published the book, Defense Against Mystery Syndromes. Amazon $129.23 for $15. Stories of people healed after amalgam removal. 14 fillings replaced. November 1994 with composites. Symptoms improved, like walking. Gerson therapy, February 1996. 129 of 2023 still on the internet. Treats cancer and digestive disease, flooding the body with pure nutrition and live enzymes. 13 8-ounce glasses of organic fruits and vegetables hourly each day. Coffee enemas to cleanse the colon. Purified water, no canned anything, toxins removed, even hair coloring, spray. Scripture, Ezekiel 9:2, judgment against idolaters. 55-year-old MS symptoms, hand tremors, balancing problems, trouble walking, legs felt heavy, knees buckling, frequent falling, leg muscle spasms, loss of appetite, recurring nausea, severe constipation, incontinence, bladder and bowel, chronic bladder and kidney infections, chronic fatigue, pain in the hands, stinging, recurring electric shocks, sensations, feet and legs, severe depression, mood swings, symptoms, temporary partial paralysis in the legs, short-term memory loss, loss of concentration, confusion, slurred speech, difficulty in making single decisions. Delivered to your door. Brian Tracy, change your situation. Page 663. Amalgam fillings and health. United States dentists place 1 million amalgam fillings a day. Controversy over dental materials. Current dental leadership considers removing amalgam unethical. Removing amalgam may jeopardize health from mercury. Attractive amalgams removed on unacceptable list. Unattractive amalgams removed on the acceptable list from ADA. Canadian studies release total exposure numbers per day in different age groups. A toddler, 3/4 get 3.3 UGs of Hg a day. Adults 20 to 59 get 9.4 UGs of Hg a day. Exposure in study estimated 50% of exposure from amalgams. Tolerable intakes of Hg proposed. Amalgams in teeth exposure from 1 filling in toddlers, 4 in adults. 1800s, the dentists started using mercury amalgams mixed with other metals. The list. Hg exposed dentists, performance poorer in cognitive and motor functions. Deficits in dentists in attention and perception. Impairments in visual graphics recognition. Dentists have heightened distress, aggressive moods, anger and confusion, headache, emotional problems, comprehension, tension, and fatigue, lack of vigor, depression, verbal skills, top 30 symptoms, more prevalent in dentists than in the population. Spontaneous remission, patients after amalgam removal, members growing. 1984, ADA reported 5% of people with mercury suffered from toxicity. 5% termed insignificant by the ADA. 5% of the U.S. is 12 million people. Following months, ADA changed the number to 1%. Now, the number ADA claims 1 in a million reacting to mercury. 1 in a million is 250 people in the U.S. is sensitive to mercury. Skin cancer claims life. Parents said, I can become anything. Shop for your healthcare needs. Page 663. The argument for ADA's HD used 150 years with no apparent epidemic. Proves safety of amalgam. Medical research community, significant effects could be detected. Appropriate studies have not been initiated by the dental practitioners, manufacturers, distributors, or regulatory agencies in Canada or elsewhere. What is mercury? Dries in 30 minutes, mixed with other metals. Hg exposure has significant numbers according to the amalgams in teeth. Numbers of amalgams in different age groups. Hg exposure in tissues in blood, kidney, brain, pituitary gland, abdominal muscles, and oral mucosa. Hg exposure primarily from inhaling vapors. Vapors increase with the temperature, smoking, and coffee. Vapors increase from stimulation from chewing gum and brushing. HG exposure from grinding teeth, bruxisation, chronic sinus infection, mouth breathing. Establishment states less than 1% sensitive to HG. Contact, hypersensitive increases to 15% with amalgams. Age of fillings a factor. Peripheral and central nervous system effects associated with AG. Dentist jobs are stressful. Exposure to HG daily. Highest rates of suicide and divorce. HG exposure reaction strong enough to need medical help. T-shirts. Take. I'm in no shape to exercise. You're just jealous the voices are talking to me. Do I think like you're stupid? Do I look like your therapist? I fish because the voice in my head tells me to. Sex ed instructor, first lesson free. Russian system. The light at the end of the tunnel has been shut off due to budget cuts. A picture of a fish. Page 664. Scripture. Romans 12:16 about anger. Reader, make final decision. Yes, put more poison in my mouth. Reasonable doubt about it poisoning the body. Smoldering fire from spontaneous remissions after amalgam removal. Silver filling is a euphemism for amalgam. Amalgam placed after the drilling of a cavity in tooth. Amalgam contains mercury, silver, tin, copper, and zinc. Amalgams adversely affect a patient's health. 250,000 pounds of mercury a year used by U.S. dentists. By year 2000 will be 600,000 pounds. Studies show mercury leaks into the body. Using gold or palladium in the mouth increases mercury release. Ideal dense restorations use few metals. Noble metals safer gold or platinum. Porcelain covers reduces chemical or electrical interaction. Hodgkin's disease. Diseases not allergic reactions. Leukemia noted 1832, a short time after amalgam was introduced. Leukemia discovered in the area amalgams were introduced. First Negro got amalgams in 1904. Sickle cell anemia first noted in 1906. Disease-causing bacteria resistant to antibiotics. Silver dental fillings promote spread of antibiotic-resistant bacteria. May 25, 1995, findings reported to the American Society for Microbiology. Dr. Murray Vimy, Fritz Lockenschneider, Dr. Summers, University of Calgary. Carpal tunnel syndrome. Repeat that. Carpal tunnel syndrome. Page 665. Page 665. Amalgam alternatives more expensive. Cost differential compared to pain and suffering from amalgam. 1713. One of the first outcries about adverse reactions from amalgam. 1685. Mercury identified as neurotoxin. 1685. Mercury nitrate used for felt hats from fur. Proper sequence for excretion of mercury. 1983, research shows 13% of the group of 720 restorations had heavy tarnishing and signs of deterioration after 3 years. Another group, 35 of 99 restorations, showed deterioration after 1 year. Amalgam restoration, 10 years old, showed 17% of the restoration was still functional. The battle lines are drawn. Article in the Journal of American Dental Association, ADA. For some persons, Mercury IAOMT established amalgam removal procedures protocols. Protocols followed reduced amount of mercury released into the body during amalgam removal. Insulate the tooth with rubber dam. Alternate the source of air to patient. Place saliva ejector under the dam to remove mercury vapor. Use a high volumes evacuation with isolate attachment. Suction device pulls air from the oral environment into tubes. Section amalgams and remove in large as possible pieces. Remove and dispose rubber dam. Dispose of mercury removal, amalgam removal, precautions in addition to protocols. Remove no more than 2 at one appointment. Amalgam removal appointments make 1 month apart. Vitamin C, intravenous before removal. Hg has affinity to vitamin C in blood in the body tissue. Don't remove amalgams from pregnant women. Website not available. February 6th, 2023. IAOMT is available. Compatibility Studies at UCCS. Hal Huggins. Immune system has a dental materials section. Toxic events induce a defense reaction from immune system. Fetus formation at risk from mercury in the mother's blood. Continuous release from amalgams may be responsible for birth defects. Amalgam removal or tooth extracted releases mercury into the bloodstream. Plan pregnancy 1 year after amalgam removal. Never have amalgam removed during pregnancy. Insulin production is the slamming of brakes after sugar race up the car. Alcohol, caffeine, and fruit juice have some effect on glucose. Coffee and digestive problems, from indigestion to ulcers or Crohn's disease. Digesting protein or an inability with immune system allergies. Allergies affect people differently. Universal reactors can't be around chemicals or vitamin C. Page 666. It's all in your head. Page 85. Glucose ideal levels. Chromium deficiency caused by too much carbohydrate, sugar, alcohol, and white flour. Zinc deficiency, insulin in production, not adequate to produce glucose in the diet high in carbohydrates. Mercury causes zinc deficiency, inactivity insulin molecules. Manganese, magnesium help control glucose level excreted by diuretic effect of alcohol, the minerals. Vitamin C destroyed by smoking, stress, drugs, dietary factors. Vitamin C needed for glucose control. Nutritionally interfering with mercury detoxing. Avoid sugar, alcohol, caffeine, fruit juices, refined carbohydrates. Eat more protein, turkey, and beef. Avoid partitioned and more overcooked food. Avoid tobacco products. Cholesterol levels caused by sugar, alcohol, and caffeine. Recent weight loss, stress, insufficient thyroid function, tobacco, drugs, antihistamines, low mineral levels also cause high cholesterol. Cholesterol from eggs and butter won't affect the level if sugar raises it more than anything cholesterol. Cholesterol can be controlled with diet. Chapter 6, Cholesterol and Dentistry, Strange Bedfellows. Cholesterol plays important role in dental decay and gum disease. Coors study of 1996. Amalgam had direct and adverse effect on cholesterol levels. Serum cholesterol level test captures the attention. Test between cholesterol levels and coronary heart disease. Page 667. It's all in your head. Page 86. Dietary intake. Body creates cholesterol from food which do not contain cholesterol. Ingested fats enable nutrients to be absorbed. Proper fats in the diet help weight control. MS patients have problem with myelantist nerve sheath insults against erratic electrical charges. Cholesterol needed for brain function, more than 10% of the brain. Cholesterol is part of insulation around the heart. Proper dietary fats help protect from heart disease. Cholesterol necessary for sex hormones, testosterone, and estrogen. Butter during puberty, not margarine, for proper sexual maturation. Butter during puberty, not margarine, for proper sexual maturing. Cholesterol needed for energy in red blood cells. Enzymes system dependent on fats. Absorption through intestines through fat solubility. Cholesterol dependent. List of symptoms from sugar, alcohol, and chocolate. Margarine, soft drinks in your diet. Hot cake stack and healthcare facts. Page 668. Germanium, the missing element. Trace mineral, germanium 132, not toxic. Side effects. No toxic side effects. Wide range of health benefits. Boosts immune system. Normalizes high blood pressure and cholesterol. Protects the body from cellular aversions and abuse. Pain relief. Alleviate rheumatoid arthritis. Normalizes psychological functions. Key references. A picture of John with a flag. How to look irresistible parties. Exclusive bonus gifts. Near Cattleman's Pool. Lentil stew. Sweating. Find it in their class. Principle of TJH. Our view, the proof is in the pie. Are you looking for your son, Dad? Travel vacations. Astrograph. Jesus, needlepoint. Page 669. Germanium, nutrients in public knowledge. Picture of John, date 11/12/1993 on computer desk 5/23 of 95. Picture of a map of the U.S., the East Coast. GE 132, chemotherapy and immune therapy. July 19th, 1981. July 19th is when I met Jeffrey. Super savings. Page 670. Medicine and dentistry. A concomitant origin accompanies or follows something. Dentistry begins in the U.S. Medicine began in Germany, went to the U.S., became an allopathic medicine, science based on modern medicines. Utilizing the teeth as a way to measure energy flow. Individual teeth correlate to all of the body's organs and tissues. The 4 wisdom teeth are all on the small intestine meridian. Stomach meridian encompasses the 4 upper molars. 4 lower bicuspids. The large intestine meridian passes through the 4 lower molars. 4 upper bicuspids, the gallbladder and the liver meridians. The bladder and kidney meridians run through upper and lower anterior teeth. 12 teeth at the front of the mouth. Electrical pathways help to localize major problems in your mouth. Infections from dead teeth with root canals, osteocavitations, toxins from heavy metal, stress from poor occlusions, blockage or closing of an opening, blood vessel or organ. Energy meridians affects the whole body. Sensitive teeth tell us there is something wrong with an organ system. Teeth can affect anything on this organ system. Calcium at cellular level needed for good energy level. Calcium deficiency or an inactive contamination interferes with energy production. 90% of all reactions in the body concern these minerals. Inactive calcium, magnesium, zinc, copper, iron, manganese, calcium deficient can be caused by diuretics, water pills, or meds for high blood pressure, or lecithin, loss of electrolytes from sweating, Counter Pride and Small Stock Journal, 1996. ADA claims safe amalgams may cause her death. Zinc and potassium in the inactive high ranges. As with manganese, symptoms are those of deficiencies. High zinc levels related to cheese in diet. Absorbed from inhaled air, Americans amalgam fillings installed in a mouth. Mercury vapor tester. MS Society does not have an opinion. May 1984. MS Society letter recommends keeping amalgams. Teens. Transparent tape. Page 92. It's all in your head.